Um, I'm Susan Forster with the California Department of Public Health with the Network for Healthy California. And I'd like to thank the White House for your support of Healthy Hunger Free Kids Act, and particularly for the SNAP-Ed language that we hope will allow us to do public health approaches. I did want to ask a question about the Partnership for a Healthier America.
Yep.
And also to thank you for your help, your support of Let's Move Salad Bars to Schools, because that's really important.
Yeah.
But on the Partnership for a Healthier America, which is part of the corporate support for Let's Move, can you give us any advice on a state level or a local level what the vision is for connecting with corporate partners to actually bring the services to a community or a statewide level?
Yeah. You know, this is a really important point. So just a couple words on the partnership, and then talk more broadly about the role of business in the private sector. The Partnership for Healthy America was created by with the California Endowment and 4 other nonprofits to really help work with the business community to make commitments around their business practices to help forward our collective efforts. And you know, we are looking for meaningful, sustainable, measurable commitments that are going to have a real impact on this set of issues. And they are open and working with a wide array of companies, both ones that you think, like people in the food industry, but also tech companies or businesses that you wouldn't necessarily think, you know, have any key stake in this, but are really trying to figure out what can they do to help become part of the solution. This issue will not be solved unless we really engage and work with the private sector. Between what we eat, how our communities are built, between wellness programs in jobs, our healthcare, everything, you know, all these set of issues are touched and by people in the private sector. And I think, you know, there's an interesting and difficult debate about, you know, what's enough, what's good enough, what is their responsibility in this. And I think you're going to see companies stepping up to do things that may not exactly be, that certainly aren't perfect. They may be missing some major piece that we would all think, God, I don't see why they wouldn't do that. But these are efforts that I think, assuming that we can agree that they're going to have a real impact and that they're steps forward, that we need to help support and move the needle. If every time a business steps up and does something that's 70% of the way, but they get creamed because they didn't go all the way, the incentive for people to do, to make progress and take steps in the right direction is going to be lost. So I think, you know, on a local level, the organizing a group of community leaders is the first step. I was just toured Baldwin Park, just outside of LA, where they have teams of like, yay, Baldwin Park. Is unbelievable. They have teams, like, I think there's about 5 people. They have these 2 teams. The ones that I met were all women. I don't know if there was a couple other guys in the back, but the women, these were like little teams of women who were going around to grocery stores who wanted to open up in the neighborhood and say, listen, this is what we need. We need vegetables in the front. You got it? Or we're not going to support you coming into our neighborhood. And they've been working tirelessly for years with retailers, with restaurants, to really help engage in them making the changes that the community really needs. And they're seeing incredible impact. So that's where you start. I think you need to buy-in with local leaders, with city council and the mayor, and start figuring out what are the ways to engage with the private sector. And together, I think you'll be surprised. Some companies, you know, they're just not there. But a lot of other companies are realizing that this is not only the right thing to do for their communities, but it's the right thing to do their business. And that's when you know you can have some real significant, sustainable change. So I think it's critical, and it's something that we need to really work hard at in the months and years to come.
Thank you.
Thank you.
My name is Jan Green, and I'm with Kaiser in San Francisco. Some of us remember when it was normal to see a patient smoking in a hospital bed, and
Wow, really?
oh yeah.
I'm young, I guess. I don't remember that.
And okay, I do.
That's crazy.
And well, good, because I'd like to see you feel that way about hospitals selling soda.
I guess I set myself up for that, huh?
Yeah, you did. So I don't think that every policy has to start from the bottom up, and I think that this is an effort that every organization that's represented here should be able to go back and say, we are not going to serve sodas at our universities, at our university medical centers, at our hospitals, and let us be the leaders in showing smaller organizations that if we can do that, that they can do it. And I think that this is not a partnership with business, because this is a partnership with health. We should not be serving soda, and I think this would be a good place to start. I'd love to see the White House be part of this.
All right. All right, so let me say something that's probably not going to be all that popular. I understand the issue deeply that you're talking about. I think that, although I'm not going to say, that we're going to support a ban on sodas in hospitals, but I think it's clear that local communities have to figure out the solutions that are right for them. But let me say this. I think every time we reduce the set of issues to a single product, we narrow our ability to see a bigger picture, and one that is going to actually have a broad, lasting, and meaningful impact on these set of issues. This issue is not caused by one drink.
Oh, I know that.
It's not. There's evidence, there's obviously, sugar-sweetened beverages are contributing a lot of empty calories to our diet, and there's no question they're an issue. But the idea that this is somehow, in the way that we often talk about this, is the magic bullet, if only we can get sugar-sweetened beverages out of hospitals or anywhere, that somehow we're going to be basically there, I think really hurts our ability to see the much bigger picture, which is about community empowerment and redevelopment and revitalization. It's about safety for our kids to play and access all the different parts of the community that's going to foster their health. It's about a much broader food landscape that is the foundation of health. And so I would caution any effort that reduces the issue to such a narrow way and doesn't address, say, all the other food in that hospital. So I would argue you should talk to all the hospitals in your community about all the food that is being served, and why can't we get a much healthier array of options for people who are trying to get well. So, although I acknowledge the portion of the issue that you raise, I do think that the solutions are much broader than that. Are we done? Thank you guys so much.